Okay, healthcare is interesting. Let's go to that story. Vermont now is really moving forward on the single payer healthcare story. We talked about it about a month ago. Vermont proposing a single payer healthcare system. The Senate gave final approval. Certain amendments were put in place to make the bill more palatable for businesses. Then the House of Representatives also had passed it. So now it goes to a conference committee. It will be reconciled. It will then go to the desk of Governor Peter Shumlin, who strongly supports the bill. Number one, doctors have already said they would move to Vermont to practice under a single-payer, state-run healthcare system. Will people move to Vermont as well as a result of this, if it passes? I believe they will.
Well, people who can afford to, yeah.
No, that's not. Maybe some people can't afford not to. In other words, they live near Vermont, and by moving to Vermont, they can get into this single-payer system.
Well, there's a lot of factors in moving. You've got your job, your family, property that you might own, whatever. It's not that simple.
I believe that this actually will bring people into Vermont if it happens. The question is, what kind of a system will there be? Will it be a system like France, where you have everybody gets free, basic public insurance, and many people are supplementing it with private coverage, additional private coverage? The important thing is that Vermont is looking to kind of disconnect employment and health insurance, which is really one of the most important things that one of the most important aspects of this type of legislation. Mm-hmm. There's a couple of obstacles still here, though, and they are not insignificant, but legal experts are telling me that it should not hold up the bill, at least not indefinitely. Number one is that Vermont needs to get a federal waiver allowing it to opt out of the Affordable Care Act. This is where, under current law, they wouldn't be able to opt out until 2017. There is a bill to let them opt out by 2014. The other issue is they have to circumvent the ERISA laws, which prohibit states from enacting legislation related to employee benefit plans. And we can expect several lawsuits, Lewis, from insurers suing the state. But Vermont for single payer believes it's not actually going to hold up the situation. What would the plan be? How would this work? The single payer plan would be, number one, it would provide publicly financed, government-funded health coverage for everyone. It would be funded by broad-based taxes. It would put no health insurance mandates on employers, and the employers would be completely free from state government-imposed insurance obligations. All they have to do is pay taxes, their business taxes. Insurers, ladies and gentlemen, are going to do everything they can to prevent this from happening. Now, bear in mind, the population of Vermont is only 625,000. So this is not because of specific profit in Vermont. It's because of the door that this would open up. And you have to know insurers are going to go as far as they possibly can to prevent this from becoming law.
Of course, yeah.
The question is, will it work? And again, I talked to a couple of legal experts today, and they said that whether or not it will happen will depend on a number of factors. But the two legal obstacles I mentioned, they don't believe are going to hold this up.
I wonder what's going to happen to people who are employed by a company in Vermont but live in another state, like our friend who works for Vermont Yankee. He's a resident of Massachusetts, but he's employed by a Vermont company. Right.
That's interesting. I'm not actually sure what would happen in that case. In other words, you work in Vermont.
Your health care is provided by your company.
Your company provides the health care, and where are you getting your medical care, I think, is a question too.
Right.
This does bring up a lot of questions. Like, for example, if you live in Vermont, but you are traveling elsewhere, is this the type of thing that is determining where is the care being paid from? In other words, Vermont will pay for the care even if you are physically outside of Vermont. Mm-hmm. Or is this the other way around? I think that the single payer goes with the individual who is insured rather than their personal location. That's my sense. So even if you're traveling, you would still be covered.
Yeah.
But I don't know the answer to that.
Guess we'll find out.
We certainly will. Make sure that you like the David Pakman Show on Facebook, facebook.com/David Pakman Show. Let's take a break. Coming up next, I'll talk to Stacey Campfield, Tennessee State Senator, who is proposing this infamous Don't Say Gay bill. A lot of questions to ask him, Lewis. Hopefully we'll ask most of them after the break.
The David Pakman Show at davidpakman.com.